People share their worst experience with a doctor. Story 1. Posted this in another thread before, but I was 14, went to the doctor for being lightheaded a lot. They assumed I was on drugs. I told them I wasn't, but they sent me to ER for drug test, and when it came back fine they sent me home. Their attitude, oh, not on drugs after all. Guess she's fine. Years later, symptoms progressed, developed a lump under my ear, which doctors kept saying was a swollen gland probably, but I kept going to the doc and eventually I guess they got sick of me and sent me to a specialist. Only good doctor I'd ever been to, told me straight away it was a tumor, but after surgery he said I'd left it too long because it was massive, and it wound up damaging a lot of nerves in my face. Story 2. I hate that for you. I'm halfway through nursing school and one of the things I'm still trying to figure out is how doctors can brush things off so easily. My mom had a spot on her lung, but there was a lump on her tongue already that tested positive for cancer, so they focused on treating that. A few months later, and the spot progressed over her whole lung and heart. Knowing what I know now, I would have fought for her to monitor her lung better, but it probably wouldn't have changed anything. It's just bananas no one with the medical capacity thought to. If you don't mind, what's the extent of nerve damage in your face? Respond from Story 1. Sorry to hear about your mom. My dad actually went through something similar a few years ago. Doctors shrugged off the spot on his lung telling him it was nothing, and it turned out to be cancer. When they discovered that, it was too late. Doctors should have been monitoring your mom's lung too. It amazes me how they can so easily shrug things like that off. As far as my nerve damage, for the first few months after surgery I was completely paralyzed on the left side of my face. I almost looked like I'd had a stroke. Right now, I've got most of the movement back, but I've got no feeling at all on my face and around my ear. And every time I blink, the corner of my mouth moves upward, which is incredibly annoying. Story 3. At 16 I started having sex, and so I went in for my very first pap smear. I was terrified and had no idea what to expect. Plus I was very new to people seeing my naked lady parts, so I was freaked out by the much older male doctor poking around down there. I started to cry. He had no idea what to do, and so he started waving my chart in my face to fan me, and said, "If you're old enough to have sex, you're old enough for this." Note to male OBGYN: that is not a helpful thing to say to a frightened teenage girl who isn't wearing any pants. I was mortified. To this day I hate going to the gyno. Oh, and then there was the time, several years later, I went to Planned Parenthood for my yearly and to refill my birth control script. The nurse asked about my sexual partners, and I answered honestly, that I was in a relationship but we were non-monogamous. She didn't say anything right then, but later as I was paying up front, the receptionist asked if I wanted any free condoms, and the nurse said from behind me in a snide tone, "Yeah, give her lots." Thanks, bitch. Sorry you're not getting. Story 4. Psychiatrists can be twisted people in addition to being in charge of medicating other twisted people. I once had a psychiatrist tell me, "Get a gun," when I asked him what I should do to help alleviate depression. To this day I wish I would have reported that comment to someone. I also wish I hadn't been so completely speechless. I should have asked if I could get a prescription. Story 5. I'm a general surgery resident. We had a patient that had been on our service for about a year. Older fellow, very sick. Every now and then, he would go into respiratory distress, get intubated or BiPAP for a bit, always would bounce back to his baseline of 8/10 sick. Everyone called him the Rock. But not in a cool, "do you smell what the Rock is cooking" way. In a boring sick person that sits there way. Well, he had always been a full code. That means that in case of dying, we do everything we can to keep him alive. After a long time of being inpatient, my attending was sick of him and made him a DNR, which means let him pass if he starts to struggle. He didn't want this, but they got away with it saying that he did not have capacity. He was decently with it, but I can see that argument. Story 6. I went to see a doctor who happens to be an acquaintance of my parents. Told him I had a few symptoms that worried me. He immediately thinks it's an STD, asks me if I am sexually active. I say yes, and he recommends that I go do a blood test at some hospital. I go to my girlfriend's place to hang out, come back home. My dad tells me we need to talk. The doctor called my fucking dad and told him I am sexually active and might have an STD. My dad didn't even know I had a girlfriend. At this point I am pissed off. That week, I go do my blood test, hospital sends results to the doctor and he fucking calls my parents, again, to say that I am clean. Fuck you, you piece of shit, makes me mad every time I think about it. I was 21, why the fuck are you calling my parents? Fuck you. Edit, I am in Canada. I honestly don't know if there was anything in my file that said to call my parents. My dad actually doesn't really understand why I was angry, said that the doctor probably just wanted to inform important people also. I did consider complaining to the order of doctors that takes care of those things. That was about 3 years ago, so I am wondering if anyone knows if there is a time frame it has to be done within? Story 7. I once knew an OB who didn't like to work after about 5 p.m., so at the end of office hours, if they had someone in labor they would swing by labor and delivery and find a reason to do a C-section on them. Sometimes they blamed the baby's heart rate tracing, justified or not, but the classic one would be that they would check the patient's cervix and lie about how dilated it was so it seemed as if labor wasn't progressing rapidly enough, and say, "I just don't think this is going to work, cut her, and be home for dinner." Now in OB we love TLAs, three-letter acronyms, and one of the real indications for cesarean is CPD, cephalopelvic disproportion, which is where the baby's head is too big for the pelvis. But for this particular doc we always said that they cut patients for CPD cesarean prior to dinner. Edit, no, I didn't report this doc because it's not possible to report someone for a subjective judgment call. As for this doc not being allowed to practice anymore, a hospital can't revoke privileges for being a shitty doc even if they want to. The law is written in such a way that the hospital would easily be sued for restraint of trade. I don't like it either, but unless laws get changed that's what we're stuck with. Story 8. My husband was my advocate. The doc I had was the on-call for my regular doc who had a family emergency. After 2 hours of good labor, he started to tell me that I'd probably need a C-section. No reason, we figured it was just after midnight and he wanted to go home. He started telling us some bullshit about heart rate and oxygen. My husband and I were both nurses and told him no, absolutely not. There were no problems with my son's heart rate. We were watching the monitors very carefully. Fuck that guy, he was an asshole all the way through my labor and delivery. He's probably done it to lots of unsuspecting people. Story 9. When I worked in OB, we had a physician who continuously did this. Had his own private practice and partners to take over for him. Liked being home for dinner every night. We also had an OB who refused to come in for a delivery because it was raining outside. Keep in mind, this was in Michigan, which means that every winter we get absolutely dumped with snow and ice December through March, but, you know. Rain. Story 10. Before I left the city I grew up in, I had an awesome doctor. Well, nurse practitioner. Anyway, shortly after I had stopped being sexually active, I went in to have her run a full STD panel, just so I say I'd had it done. A couple of years later, no sexual activity in the interim, I quit my job to move out of state. As my insurance was running out, I decided to go in for one last physical. It also occurred to me then that my doctor had told me I should have a follow-up test done after 6 months, and I had completely forgotten to do that. So I show up for the physical and my doctor is out sick. I end up seeing one of her colleagues. Dr. Dick gave me the third degree over why I wanted an STD test done. He absolutely refused to believe that it was just a safety follow-up. At one point he flat out accused me of intravenous drug use and/or fucking everything within a 50-mile radius that moved. I finally told him I didn't give a shit if he believed me or not. He was gonna run the test and call me with the results, or I was gonna make sure the licensing board heard about how he treats his patients. Got the test done. Story 11. Similar scenario, I had never had jock itch before and it freaked me out. My doctor was on a 2-week vacation, so I went to ER. It had all but cleared up and I was still flipping out. They refused to do anything. The nurse wrote in my medical report that I had fucked a prostitute, which she completely fabricated. I had been snowboarding for a week straight, not having sex at all, told my doctor after she returned, and I am still not sure if she was able to remove that shit from my medical history. She was pissed too and emphasized that I should have waited the 2 weeks, but I couldn't help it. I was freaking out. Did all the tests with my trusted physician and all good. Story 12. Had to have a lumpectomy done about 3 to 4 years ago. The anesthesiologist came in to speak to me about general and how I would be put under for the procedure, blah blah blah. Fast forward to the surgery room. I'm wheeled in, some medication is given to me through my line, I start to feel kind of loose. Enter asshole surgeon. Anesthesiologist starts to tell her he's about to start my general. She gives him the look of death followed by, she's not going under for this. He looks at her kind of funny, says no, I've told the patient we would do general and I think that's best for this situation. Surgeon doesn't agree, says twilight only. I try to speak, I'm vetoed. In goes local and I wake up mid-surgery attempting to speak and lifting my head up freaking out. Anesthesiologist flips his shit, grabs my line, in goes general. He paced through my recovery room for the next 2 hours waiting for me to wake up. I make eye contact as I come to, he lets out a huge sigh and leaves the room. Never again do I see that surgeon. Story 13. Was just sexually harassed by sexual health doctor, so I just went to a sexual health clinic for a full panel of tests. As I walk in, the lady who was attending to me wouldn't stop staring at me. She then started talking about irrelevant things which delayed the actual test by 10 minutes. I was just trying to be nice. Then before doing my bloods, I ask if I should take off my jumper. She asks, are you wearing anything underneath? I say, yeah. She says, don't worry about it then, leave it on, no point if you're wearing something he. Then when she's offering my condoms at the end, she asks what size I am. She then says, I just want to know because I have to ask black guys these things. I said, get me the king size. She gets the king size very slowly. At this point, our appointment has overrun by about 20 minutes. As I try to open the door to leave, she blocks it and I hold back cause I wasn't sure what she was trying to do. I stare her down and she eventually moves out of the way to let me out. I don't really care because it's funny, but should I do something about this? If I was a woman being seen by a man, I would have been very put off. Story 14. I've had severe anxiety for 10 years and went to multiple therapists. It was all talk, no action. I myself knew why I was feeling the way I was, I knew the triggers, but they never told me how to actually cope with it. I also had CBT, cognitive behavioral therapy, and the therapist, who was fresh out of learning a quick college course, unbeknownst to me, would just ask me questions which I never had the answer to. Part of CBT is where you get to the root of the problem and find out how it all began, and I was only 9 when I had my first panic attack, so I could barely remember what set it off. But this woman kept on asking me the same questions every session. She only taught me breathing exercises and nothing more. I left after 5 sessions. But yeah, some therapists are assholes. Story 15. I was bullied incessantly for years. Instead of stopping the other kids, my teachers just sent me to be tested for every learning disorder under the sun. The lady I was sent to never said a word directly to me, only to my mother. Then she just sat there for a while. She didn't ask me any questions, just stared at me and took notes. After a while she called my mum back in and told her I had the brain of a 4-year-old and prescribed me pills that gave me headaches. On the bright side, I stopped bothering my teachers. If someone was picking on me, I wouldn't report it or try and fight back. I'd just sit there and cry. Story 16. Went to a doc for a regular STD panel because new girlfriend wanted me to get tested. This was my first time meeting this doctor. Got tests run in the lab for STDs. Ended up getting a bill for $2,000 because the doctor ordered STD tests covered and a metabolic panel and lipid panel and other tests that weren't covered. He didn't tell me about the other ones and claimed they are routine for new patients. 1 month later, me and the girl ended things, so I spent $2,000 for a month of sex. Edit, insurance wouldn't cover it after I complained, doc wouldn't change the billing codes or anything to try and get it covered. Story 17. Me waking up during orthopedic surgery with my arm dissected open and the doc screwing a steel plate to my humerus with a fucking power screwdriver. I screamed as the pain hit me. Doc, I thought you were out. Me, I'm not fucking out, you motherfucker. That fucking hurts. I then proceeded to scream curses in 4 languages at the poor guy. And then poof. I was out. I said some nasty shit to him. I looked him up a few weeks later and apologized. He laughed. Yeah, sorry about that. What were those other languages you were using? French, German, and Russian. What did they mean? You don't want to know. Shook hands and parted friends. After all, I owe the dude for putting me back together again. Story 18. The night after my neighbor had her baby, her partner came over to show us pictures. First it was just selfies they took while she was in labor, but after 20 hours they decided to cut her open instead. Her partner took pictures of everything. My dad and brother couldn't look at them, but I thought they were pretty cool. Then I looked at her Snapchat story and there was a video of a doctor putting in an IV line. I threw up. Story 19. Finally, I can contribute something meaningful to AskReddit. Back in 2008 I was in a car accident, and I didn't think I had gotten injured. However, my hands started swelling. I went to a clinic nearby with this complaint, and the doctor prescribed prednisone. I started taking that, and the swelling on my hands went down. Unfortunately, 3 days later I was in the ER going in and out of a coma because I was apparently an undiagnosed type 1 diabetic. Prednisone is the perfect drug to kill a type 1 in the most horrible manner possible, it turns out. A close runner-up to that is my experience with a testicular torsion injury. The doctors and nurses were all great, but there is no way to have your balls cut out and reinserted without life being really horrible for a while. Story 20. I was misdiagnosed. He led me to believe I had a chronic, lifelong illness that would shorten my lifespan, require daily medication, and have regular periods of awfulness caused by the illness. I got a second opinion. The new doctor found I had a serious but very treatable infection that was cleared up in 30 days with the proper medication and have been completely normal since. Story 21. I've been there. I was so depressed because of the diagnosis and the changes I was having to make to my life and the cost of my treatments. Then I got a second opinion. Turns out I didn't have the chronic illness, just a poorly timed emerging nickel allergy combined with a dietary intolerance. TLDR, always get a second opinion on major diagnoses. Story 22. Woke up one day and was unable to hear out of my left ear. I waited it out for a few days to see if it would improve, but I did not get better at all. I went to the doctors and they diagnosed me with a nasty ear infection and gave me some antibiotics for it. After using up all of the antibiotics, I went back and they prescribed me stronger ones. Those ended up not working either. This cycle went on for another month until I eventually decided to go to an ear specialist. Within 5 minutes the specialist was able to see that my eardrum was not infected, but rather covered in wax. At the end of my visit I had my hearing restored. It's safe to say that I was furious that the doctors misdiagnosed me for an entire 2 months and shoved antibiotics into that I didn't need.